Hello, everyone, and welcome to another Health Reform Beyond the Basics webinar. Thank you for joining us today. So before we begin, all of us at Beyond the Basics really just wanted to send our gratitude for all the intense work that you all have done to make this open enrollment period as successful as possible. And to those of you whose open enrollment period has ended, congratulations on a job well done. So for those of you who are new to our webinar series, this is a project of the Center on Budget and Policy Priorities, which is a nonprofit policy think tank in Washington, D.C. This series is designed to help advocates, assisters, state and local officials, and others assist people to access and understand the Affordable Care Act's health coverage options. It's intended for those working on the implementation of health reform and is not intended for press purposes. So today's webinar will focus on post-open enrollment issues, such as the new rule that allows insurers to demand payment of past due premiums before 2018 coverage can be effectuated, tips on resolving data matching issues, and information on certain special enrollment periods that are available now that open enrollment has ended for most states. Okay, so to guide us through today's topic, please welcome Tara Straw, who's a Senior Policy Analyst at the Center on Budget and Policy Priorities, Shelby Gonzalez, who's a Senior Policy Analyst, and Hallie Cloud, who's our Health Outreach Manager. So first up, Tara will be talking to us.
Thanks. So first, before we get started, just looking at what's in the news today, it appears that the tax bill is going to become law. One of the elements of the tax bill is a zeroing out of the penalty for not having insurance coverage. We just wanted to note and remind people that doesn't occur, isn't effective until 2019. And so for 2018, it's still really important to get people to effectuate coverage. There's still a penalty in effect for 2018. And so we want to make sure as many people as possible have coverage for this year. The other thing we wanted to note is that, some of you may remember from last year that the IRS was accepting returns that didn't make any, the so-called silent returns that didn't provide any information on coverage. So people could submit a tax return that didn't have, that didn't indicate months covered or exemption or pay a penalty. This is no longer the case for this tax year, for tax year 2017. The IRS is going to be requiring that information on tax returns that are filed this spring. And also, we wanted to note that that the Center on Budget is going to have a webinar in early January that's going to talk about some state options to boost enrollment. So look forward to that, and we'll send out information to some of you on this list. All right, so with that, let's move on to the issue of past due premiums. For coverage beginning in 2018, insurers can refuse to enroll a person who owes back premiums to an insurer or members of its controlled group for the past 12 months, unless a person pays a prior premium debt. And also, insurers can apply any payments that are made to the past debt first before applying to, for instance, the binder payment. So this is a policy that may affect effectuation of coverage this year. And so it's helpful for assisters to be aware of it. So if you have people who don't understand their bill from the insurance company, this may be a place to look as a potential source of confusion. We don't really know how many insurers are adopting this policy. This information isn't publicly available. We'd have to go from insurer to ask if this is a policy they're going to be applying. And implementation is also subject to state law. So there may be state laws that help protect consumers, but I don't think that that's widely the case. And it's notable that this applies whether enrollment occurs during the open enrollment period or during a SEP. So anytime you're looking to start new coverage, there is a potential that this policy may apply. We will note, we have it noted there that this is in effect for coverage beginning in 2018. That's not quite true. The look-back period can't extend earlier than June 19th, 2017. So that's the date that the regulation was finalized. And so someone has to have have been told about the policy, which we'll talk about in a minute, and two, have been had their non-payment month occur after that June 19th date. There is a pretty strong notification requirement in the rule. To implement this rule and adopt the policy, insurers have to notify individuals of the consequence of non-payment on future enrollments in both their enrollment application materials and their notices regarding non-payment of premiums. Now, I will say that it's great that there is a notification requirement, but we all know that when you're enrolling in insurance, there's a lot of fine print. This is one of the things that can be in that fine print. So the place a person is really most likely to see it is going to be when they've missed a payment and they get a bill from the insurer that says you missed a payment. There, it should also have in that notice their policy on the consequence of non-payment. An insurer also can only apply the policy to someone who is contractually obligated to pay the premium. So let's say that you have a college student on an insurance policy with their parents, and the parents fail to pay a premium. Then next year, when the college student has graduated, is enrolling in coverage on their own in the marketplace, they can't be subject to this policy, or they can't be obligated to pay the old past due premium. It was their parents' obligation because they were the contract holder. In order to really understand how the past due premium policy works, you have to start with the grace period rules. So we're going to do a quick review of the grace period rules. Nothing has changed related to the grace period rules, but it's important to use this as a foundation for understanding how the rules have changed. An enrollee who receives premium tax credits has a 90-day grace period for catching up on missed premiums. And if you fail to pay all owed premiums by the end of that third month, coverage is terminated retroactively to the end of the first month. So you can see in our little graphic there, the first month of non-payment starts the grace period, and it ends at the end of the third month. But if you fail to make all the premiums owed, your coverage will be terminated retroactively to the end of the first month. That means that you won't have any health claims paid in months 2 or 3. In month 1 of the grace period, health claims will be paid, and that premium is something that you're going to continue to owe, and insurers can send you, for instance, into collections for that premium. It's notable that this policy only applies, the grace period policy only applies if enrollees receive advance payments of the premium tax credit. It doesn't apply if someone has not been receiving APTC, even if they're eligible to receive it. In that case, the state grace period rules would apply. And in general, states only have a 30-day grace period. So it's also important to understand what happens to these folks in reconciliation. If someone has coverage terminated during or after a grace period because of non-payment, what happens to them on their tax return? Because it really sort of affects our course of action and our recommendations for people who are going to face the past due premium policy. So at reconciliation, if an enrollee becomes uninsured due to termination of the grace period, then in all 3 months of the grace period, they are considered uninsured. They're considered uninsured in the first month because they failed to pay their premium, even though they've received APTC. And the first month is also distinguished because in the first month of the grace period, a person on their tax return really has a choice. They can pay their premium by the tax filing due date, or they have to repay their APTC for that month. So it's important to keep this in mind because people should know that they have this choice, because APTC is often 2 or 3 times higher than the premium, and so someone can pay less overall if they're paying the premium versus repaying the APTC in many cases. Now, in the second and third months of the grace period, the issuer has collected APTC on behalf of the person but should have repaid it to the Treasury. And so if you see someone who has a 1095A that indicates that they received APTC in the second and third months of a grace period, that's just an error. So that should be challenged with the marketplace, because that shouldn't have happened. So the lesson here related to reconciliation is that if someone has their coverage terminated at the end of a grace period because they failed to pay, they may have to pay that first month's premium no matter what. So they may have to pay it either when they want to re-enroll with the same insurer for the following year, or it's going to come and bite them at tax time. And so if people sort of know up front, okay, I'm going to have to pay this premium or pay back APTC on my tax return anyway, it does make sense to, you know, if it's possible, to pay it earlier at the time of open enrollment and make sure that you can get into coverage for the following year. So we're going to go through some examples that illustrate how the past premium debt policy works. So in all of these examples, we're using Jane, and we are assuming that she has premium tax credit, she's getting APTC, and we're also assuming that her insurer has notified her that they have adopted the past premium policy with an effective date after her first missed premium. So in this example, in late July, she missed her August premium. That kicked off a 3-month grace period that started August 1st. She doesn't pay, so we come to the end of October, October 31st, and her grace period ends. Her coverage is terminated retroactively to August 31st. Jane picks a plan in 2018 with the same insurer. She's going to have to pay, to effectuate her coverage, she'll have to pay her August premium and her January binder payment to enroll in 2018 coverage. If she doesn't pay the past premium debt, she won't be enrolled in a plan for 2018. And it's not the case that you can just say, I'm going to pay January, I'll pay the August premium when I have the money. Because if you make a payment to the insurance company, they're going to apply it to your earliest debt. So they will apply it to August, and that means that you may fall short of what you needed to pay to effectuate January's coverage. Now let's assume that instead of having a grace period that happened earlier in the year, that instead she has a grace period that starts in November. So in October she missed the November premium payment, a 3-month grace period starts, and that grace period is going to end at the end of January. So it spans the year. There are special rules for grace periods that span the year. We'll say that Jane picks a plan in 2018 with the same insurer. She's going to need to pay all of her owed premiums to effectuate her 2018 coverage. So she'll need to pay November, December, and January. So why is that the case? It's because when you're in a grace period, nothing has been forgiven. If you're still in the grace period, then technically you still owe for all of those months of the grace period. And so because Jane was still in the grace period when she was billed for her insurance coverage, she's going to owe not just November's payment, but also a payment for December and for January, the first month of her new coverage. And if she only tries to pay January's payment, it's going to be applied to her prior debt first. And we'll do one final example. In this case, let's assume that Jane had a data matching issue that led to the loss of APTC. And we're going to say the loss of APTC was effective March 1st, 2018. So that means that she lost her APTC March 1st, 2018. She's given a bill for the full premium. She has no APTC to offset part of the premium. She can't afford to pay because it's the full premium. And because she can't pay, her coverage ends March 30th. Now, in this case, she's not given a grace period because she's subject to, or she's given only a 30-day grace period, so to the end of March. She's not given the full 90-day grace period because since she does not have APTC, she's operating under state law. Most states only give a 30-day grace period. So that's how she gets a coverage ending date of March 30th. So fast forward to open enrollment, she picks a plan with the same insurer. In that case, she's going to have to pay January's premium plus March's unsubsidized premium. So she will have a big mountain to climb in order to effectuate coverage for the following year. Just a couple last tips about handling this issue and the implementation of this new policy. So the first thing that I would ask if someone comes into me and has a premium bill that they don't understand is I would ask if the bill is correct. So were they given notice of the insurer's adoption of the past premium debt rules? Did the person even miss any premiums with the insurer? Did the insurer terminate coverage in accordance with the grace period rules? So if there was a grace period, the person should only owe for that first month of the grace period. They shouldn't also owe for the second and third months. So it's really important to make sure that the bill is correct and that when you get it, the 1095A is correct. And then, are there other protections in your state's laws that will prevent an insurer from either applying this policy altogether or affect how they apply it? If you do disagree, or if the enrollee disagrees with the insurers, with how the insurer has applied the past premium debt policy, then you can report it to the state's Department of Insurance or to the marketplace. And this is also a good time to make a reminder that it's really important to make timely coverage terminations. So it was practiced widely before in the individual market, before the marketplaces, that people could use non-payment as a method of termination. So when you wanted to cancel your insurance, you just stopped paying. That's not a good policy here, because if you mean to cancel and you just try to cancel by not paying, you're going to have at least you're going to have one extra month of coverage that you're going to need to pay for, or it's going to potentially block your access to marketplace coverage for the following year. So an important reminder to folks that it's not a good practice to terminate by non-payment. Instead, you need to tell the marketplace that you want to terminate your coverage. So next, we're going to go to Shelby.
Thanks, Tara, and hello, everyone. I'm going to do a very quick overview of the roles that you all can be playing when helping somebody who has a data matching issue. And I am doing a very high-level overview, but we have a webinar that we've done very recently, and it's recorded and it's on Beyond the Basics, so I invite you to listen in more if you want some more details about data matching issues. So here we go. So generally, when a person is completing a healthcare.gov application, they will be providing information into the application, and the application will use that information to check against trusted data sources. Oftentimes, those are government data sources like the Social Security Administration. And whenever possible, the application will try to prove those circumstances without having to request that the consumer send in documents to prove whatever eligibility factor, whether that might be income or citizenship or immigration status. Those are the big ones that we see come up often. When the consumer is not able to have their circumstances checked in this way, then they get what's called a data matching issue. Sometimes we refer to it also as an inconsistency. So we're kind of inconsistent in how we talk about it with you all, and others in the marketplace are sometimes equally as inconsistent. But the bottom line is that when somebody has a data matching issue or an inconsistency, it means that healthcare.gov was not able to use the information that the consumer provided to substantiate that they meet the eligibility factor. What will happen in that case is a couple of things. At the end of the application process, after you hit send, you will get a on-screen notification, as we show here in this first picture, that will say that your eligibility is temporary, and will give a little bit of information about what you will need to do. When you open up the eligibility determination notice, there should be additional information about who has a data matching issue within the households and what information needs to be provided. In addition to this, consumers will also get other notices that not only just remind them that they have this data matching issue, but it will also tell them that more information about how to resolve the data matching issue. They will get lots of notices throughout this process, and they have between 90 to 95 days, depending on what kind of data matching issue there is, to turn in those documents. If they fail to resolve the data matching issue within that time period, then they really will risk either the termination of their marketplace coverage, or either the loss or the adjustment of the amount of premium tax credits that they get. So I'll go into a little bit more detail on each one of these. We're going to focus mostly on the two big ones, which again are income and then the citizenship and immigration. So first, let's talk about income. So one of the key things to keep in mind is that when you are trying to resolve a data matching issue related to income, is what you're really trying to do is you're trying to provide proof that matches or comes close to matching to what you have said the income will be when you were completing the application. So by completing the application, if you're helping a consumer, you're helping them to kind of do the best guess that they can to say, this is what my income will be for 2018. If you then go and decide that we're going to just take what our taxes were in 2016, because that happens to be one of the very many items that are listed in a long list of documents that could be sent in to prove the inconsistency, but that 2016 income really does not look anything like what you're projecting 2018 is going to look like. It's not going to resolve the issue. So it might be that pay stubs are better. It might be that a letter from an employer might be better as an indication, to be able to prove that the attestation that's made. In some cases, no documents are available. In that case, we really strongly recommend that you send in an explanation. When you're sending in these documents, including explanations, including documents for maybe multiple people within the house, I would err on the side of being, way too organized, like just really, really, really detail. We are projecting that Shelby's income is going to be X, and here we have submitted, we've attached Y, with like a little explanation, and really kind of paving making it very, very, very easy for the person who's going to receive the documents to understand how you're putting, all this information together to verify income. Could be very helpful. As a reminder, and I kind of mentioned this before, that every household member whose income is counted towards the eligibility determination really must send in proof of their income. It's not just enough to say, well, we'll put in Shelby's, but we're not going to put in Shelby's husband's income. It really is going to be looking at the whole household's income circumstance. So trying to provide proof for every member who whose income is counted is really helpful. Sometimes we hear that as people are working with a family to kind of put all of this together and say, okay, let's review what we put in and what our projection was around the income, and we start lining up documents to kind of prove that income, you realize, wow, maybe that projection wasn't as great as we thought it was. In that case, you should go back into the application and, update the application with the better projection of what the income might be. In some cases, that will be enough to clear the data matching issue. In other cases, you'll just have a new data matching issue, and in that case, again, you're going to be collecting the documents, and you're going to want to send in what can prove that income. If a data matching issue is not resolved, consumers may have to pay either they could lose all of the premium tax credit, or they might have to pay a larger share of the premium. Basically, there can be an adjustment to what they're paying for the premiums, which might result in coverage being unaffordable, which might result in them, maybe not terminating coverage in time and then having a premium debt. And Tara just explained to you how complicated that can get. So really looking out for these data matching issues and helping families to avoid any kind of surprise larger than what they expected premium can help avoid any kind of other problems later on down the line in terms of carrying this premium debt. Next, I just want to talk a little bit about immigration and citizenship data matching issues. A couple things to keep in mind. It's one of the first things to think about is that only people who are applying for coverage for themselves, who are going to have coverage themselves, must verify their immigration or citizenship status. They're the only people that should even be asked the questions about citizenship or immigration status in the application. I want to remind you that because I have heard of a couple of isolated instances this year where some non-applicants were asked to provide documentation about their immigration or citizenship status. We have not completed kind of investigating what went wrong. We hope that this was very isolated, or maybe that it's consumer error. Maybe they accidentally indicated that they were, applying for coverage for themselves, but we don't know yet. So if you've seen that happen, please get in touch with us and let us know that has happened. And give us some, we'll ask you for some additional information. But generally, we're only talking about people who are getting coverage that are the ones who need to make sure that their immigration or citizenship status is documented. Another thing that we have seen come up, especially last year, I saw a few examples of this, is where people may not have made quite by accident, made the wrong attestation about their immigration or citizenship status. So for example, I saw some citizens who indicated they had an eligible immigration status, and you can kind of see how this can happen, right? Because these questions are a little bit cryptic and a little bit difficult to follow sometimes. So, they might have just missed the citizenship question for some reason and thought that, and then they were like, yeah, but I'm eligible. So in any event, you want to double check. And also there's another way that this could happen, and you can see it kind of play out. A lot of people apply over the telephone at the marketplace, and you're not necessarily looking at, the screens while the person is, and they might have asked you the question, or maybe they mistyped it, or for whatever reason, sometimes the attestation does not match with reality. And what would happen is I could submit my passport, which is a great document to prove my citizenship, over and over and over again. But if it's proving my U.S. citizenship and my application says I'm an immigrant, they're not going to be able to use that documentation to prove that I'm eligible for coverage, because if there's an inconsistency between the information I provided and information that I'm sending in as proof of that attestation. So the other thing that folks might want to do is to check to make sure that the document numbers that you entered on the application are correct. And certainly on the immigration side, it can be extremely tricky to figure out, and also for naturalized citizens as well, to find, which is exactly that A number that the application is looking for, and sometimes there's several numbers. So it's worth it to, we have a guide that's on Beyond the Basics. It's worth it to look at that guide, look at other guides that are available on healthcare.gov and other places, and see if the right numbers are being used. Sometimes by going back, you might be able to resolve the data matching issue without having to submit documents. The other, issue to kind of consider is for U.S. citizens. It's U.S. citizens need to prove both citizenship and identity. And when I say identity here, I don't mean identity like identity proofing. I mean identity like, a driver's license or something else with a picture ID. Oftentimes, the person that you're working with will have something like a U.S. passport that can prove both that I'm a U.S. citizen, right? If I give them my passport, proves both I'm a citizen and it has a picture and some additional identifying information in it, which that's enough. But there's a lot of people who don't have U.S. passports, and they might want to turn in something like a birth certificate. If that's the case, then they might have to turn in 2 documents. Again, in our data matching issue webinar, we have more information with details about all the different documents that can be turned in for citizenship. If a DMI is not resolved, regarding immigration or citizenship status, the consumer is disenrolled from the marketplace plan, so it's different than the immigration than the income one. The income one will adjust the level of premium tax credit. In the case that somebody loses, in the case that a person has an unresolved data matching issue, the marketplace will actually disenroll them from the marketplace. Those consumers could still apply for coverage outside of the marketplace if needed. They can also, now turn in their documents later after the fact, and they could potentially result in a gap in coverage for them, and this happens. So you definitely want to get the documentation in as quickly as possible. But in the case that somebody loses coverage because of a DMI, at least in past years, they've been able to get a special enrollment period if they were able to then submit documents after that temporary loss of coverage and then re-enroll. And with that, I'm going to turn it over to Hallie.
I'm going to take questions.
Oh, sorry.
So right now we're just going to stop for a few questions. We've got a lot of really great ones coming in. So first, someone was wondering whether the past due amount has to be paid at the time of enrollment or whether that could be rolled up into the first payment due in January.
No, it wouldn't be paid at enrollment. It would be wrapped up into that first payment. So it should be clear on the bill whether there is a past due amount, because the bill would be larger than expected because it would include that amount. So it would be paid at the time of the January payment. Although if it's past due, you can pay it any time. But as far as whether or not you get coverage, it doesn't have to be paid at the time of enrollment, just in time to effectuate your January coverage.
Okay, and what happens if an insurance company is no longer in the marketplace? Do the consumers still have to pay the previous missed premiums?
Well, technically, if you owe a premium, you owe a premium. So if you lost coverage after a grace period because you didn't pay for 90 days, then you still owe that first month's premium, or you will need to repay the APTC you received on your taxes, one or the other. So whether or not it affects you, whether or not the insurance company has adopted the policy, or whether it affects your ability to effectuate coverage for the following year, technically that's still something you owe, and the insurance company can hound you for it or can send you to collections for it.
And if a consumer can't effectuate coverage because they have past due premiums and they go uninsured for 2018, what happens if they apply in 2019? Will that past due amount from 2017 still be owed?
No, the past due amount, they can only look back for 12 months. So it wouldn't affect someone for coming into coverage for 2019.
Okay. And someone is wondering why repaying the APTC would be more expensive than repaying the plan premium, because they thought that APTC is a % of the plan premium.
So by premium, I'm referencing the enrollee's share of the premium, not the total premium. So I think the average is that the APTC is nearly 3 times greater, or maybe more than 3 times greater now than the enrollee's share of the premium. So just mathematically, it is more cost effective to pay for the enrollee to pay their share of the premium versus paying back the APTC, assuming they have the cash to do either.
Wonderful. And we've gotten a lot of really great questions, so we'll take some more after Hallie's presentation.
Thank you so much, Hannah. So now we're going to go through a few kind of common SEPs that you are going to see now that open enrollment, the general open enrollment period has ended in most states. So as a lot of you know, open enrollment isn't over in every state. This is the list of state-based marketplaces that have extended their open enrollment. Most of these extended into January and even to the end of January. So I'm not going to go through every state, but this is a list for your reference, and you can refer to it whenever you need to. But for states that that open enrollment has ended, who can still enroll in coverage? There's actually quite a few ways that people can still enroll, especially right now. So first, anyone who, just sort of broadly, anyone who experiences a SEP qualifying event is going to be eligible for an SEP. And that's just sort of a general rule. Once open enrollment is over, if you experience a qualifying event, you can get an SEP. But there are a few sort of specific SEPs that you're going to see a lot of in the next few months, depending on your state. So we wanted to go into more detail on those. So an overview of what we'll talk about today is first, there's a broad exceptional circumstances SEP that is available for people affected by recent hurricanes or other natural disasters. This SEP is currently available in states using the healthcare.gov platform, and it essentially extends open enrollment through December 31st for those who are eligible. The second is a loss of coverage SEP for people whose 2017 plan was discontinued for 2018. And then the third one is a little bit of a tricky one for those who become newly eligible or ineligible for premium tax credits. And this applies for people who were auto-enrolled into a 2018 plan without subsidies. So it's sort of a subset of people who are auto-enrolled. So first, we're going to talk about this somewhat time-limited exceptional circumstances SEP that's available to anyone who is living in or moving from an area impacted by recent hurricanes or other natural disasters. This SEP is available to anyone who is living in or who moved from a county declared as meeting the level of individual assistance or public assistance by the Federal Emergency Management Agency, or FEMA. This link on the slide lists all the counties that meet this criteria, and it's actually a pretty extensive list. The SEP is sort of generally referred to as the hurricane relief SEP, but it is definitely available more broadly than just to states like Florida or Houston, who are really impacted by recent hurricanes, and so we'll get into that list in a second. First, though, it's important to reiterate that this specific SEP is only available in states using healthcare.gov. State-based exchanges can implement their own broad SEPs based on a natural disaster or any other exceptional circumstances. And as we mentioned at the beginning, most state-based exchanges have actually extended open enrollment for everyone through January, or at least into January. So what does this SEP do? It essentially extends enrollment through the end of the year. People have until December 31st to request an SEP because of living in or moving from an area affected by a natural disaster. Healthcare.gov may extend that deadline longer if the need arises, but we don't have any additional information at this time about that. So for now, the deadline is December 31st. So as I said, this SEP is available in a broad list of places. It includes the entire states of Florida, South Carolina, Georgia, and Alabama, as well as a huge number of counties in Texas and Louisiana. In addition, there are a few counties in Mississippi who are eligible for an SEP, and also recently they added areas of Maine that were affected by recent windstorms and had resulting power outages. Also, anyone moving from Puerto Rico or the U.S. Virgin Islands who intends to reside on the mainland, and even if they don't have a fixed address yet, they are also eligible for an SEP. Now there's a link at the bottom of the slide from the Kaiser Family Foundation that includes a more comprehensive list of which counties are eligible for this SEP. So you can use that as a resource to see if your county is one of the affected counties. Now, anyone who is eligible for this SEP can access it by calling the Marketplace call center and requesting this SEP by December 31st. The call center is going to send the request to the Marketplace for review, and once eligibility is approved, the individual will receive a notice, and that notice will have information about how to enroll and the appropriate coverage effective dates. It is important to remember that you don't have to, even though you have to request this, even if you have to request this SEP over the phone, you do not have to fill out the application over the phone. You can fill out the application online and then call the call center to request the SEP. So that will make it a little bit easier. Also, eligible individuals should not have to provide any documentation that they're eligible for this SEP. The attestation should be enough. So now we'll go into the next SEP, which is going to be pretty common this year, especially if you are in an area where a big insurer left the marketplace. This SEP is available to anyone whose 2017 plan was discontinued for 2018. There's been a lot of confusion over what counts as a plan discontinuation, but basically if a person's current 2017 plan is no longer being offered in the marketplace next year, then that person is eligible for an SEP based on a loss of other coverage. This applies if an insurer simply leaves the marketplace altogether, which was much more common this year than in past years. But it also applies if a person's insurer is still offering plans, as long as that person's particular plan is no longer being offered. So that's kind of the key. And in cases where an insurer is still offering other plans, generally people had the option to be auto-enrolled into a different plan with the same insurer, but they're still eligible for this SEP. So the SEP applies regardless of what a person did or didn't do during open enrollment. They are losing coverage, so they're eligible for this SEP even if they were auto-enrolled into a new plan, if they actively chose a new plan during open enrollment, if they updated their application in some way, or if they weren't eligible to be auto-enrolled or simply requested not to be auto-enrolled into a plan and don't have coverage lined up for 2018, they still get this SEP. So that's really important. Like any loss of coverage SEP, they're going to have 60 days before or 60 days after the discontinuation date to enroll in a plan or to change plans. Because this SEP applies to a marketplace plan discontinuation, the end date is always going to be the last day of the enrollment year, which is December 31st, 2017. So how do you know if someone's plan was discontinued for 2018? One key way is to look at the notice that a person should have received from their insurer about the availability of their current plan for the 2018 coverage year. These are standardized sample notices that are on your screen right now that insurers must use to inform consumers of whether or not their current 2017 coverage will be available in the coming enrollment year. They're pretty confusing notices, but the key thing to look for is that highlighted area that says beginning on blank date, we won't offer your current health coverage in the marketplace. And then it lists the last date of coverage for that plan. This is a discontinuation of coverage, and they are eligible for an SEP because of this discontinuation, even if the insurer has another plan available in the area. So how do you get this SEP? Most of you are pretty familiar with these questions in the healthcare.gov application about whether a person is losing coverage in the next 60 days or has lost coverage in the past 60 days. State-based marketplaces might have slightly different questions or pathways to report a loss of other coverage, but the general rules are going to be the same in state-based marketplaces as well. So before the end of the year, so before the 2018 plan has ended, people using this SEP will have until December 31st to select a new plan or to change plans, and that coverage will begin on January 1st. After the end of the year, once the plan has ended, people have 60 days to report the loss of coverage and to switch plans or enroll in a new plan. Once they select a plan using this SEP, the new coverage is going to begin on the first day of the month following plan selection. So let's walk through an example. This is Katie. Her 2017 plan was discontinued because her insurer left the marketplace entirely. She was matched with a new plan with a new insurer, but she didn't return to the marketplace at all during open enrollment. Once open enrollment ended, she was auto-enrolled into that new plan that she was matched with, but she needs to pay her first month's premium to effectuate coverage. She receives a bill in December for that first month's premium. So let's see what happens if Katie wants to change plans before the new coverage year begins. Her plan was discontinued, so she's eligible for that SEP. She returns to the marketplace and reports that she is losing coverage December 31st, 2017. An SEP is triggered, and she uses it to change plans. Her coverage will begin January 1st, and she'll need to pay that first month's premium for the new plan that she just chose using the SEP. Now, what happens if Katie waits until after January 1st to report this loss of coverage? Let's say that she paid that January premium for the plan that she was auto-enrolled in, and her coverage was effectuated January 1st. In February, she realizes that her doctor isn't in network in this new plan, and she would like to change plans. She can, at that point, go into her application and report that she lost coverage on December 31st. She will have until March 1st to use her SEP to select a different plan that better meets her needs. Now, a little confusing, but important to point out here, if she never effectuated her plan that she was auto-enrolled into for 2018, that plan enrollment will be canceled, and so she won't have any coverage starting on January 1st. But she's still eligible for this SEP, so she can enroll in a new plan and anytime before March 1st, and her coverage will begin the month following plan selection. So whenever she chooses that plan, her coverage will start at the beginning of the next month. Also, it's important to note here that anyone using this SEP should not have to turn in any documents to verify that they lost coverage, because the marketplace should have a record of the discontinuation of their 2017 plan. However, if someone is asked to turn in documents to verify the loss of coverage, you can use that notice from the insurer that we showed you earlier that informs consumers that their 2017 plan will no longer be available for 2018 as a proof of loss of coverage. But again, they shouldn't be asked to verify via documents for this particular SEP. So now we're going to go into this last SEP, and it's a little bit less common, but it's pretty confusing, so we wanted to bring it up here today and talk through it. You may remember from some of our recent resources and from past webinars on the auto renewal process that there are certain people who cannot have their premium tax credit eligibility redetermined through the auto renewal process. There's a variety of reasons why this is the case, and you can see them all listed here. But in all cases, if the individual does not return to the marketplace to resolve the issue, then they're going to be auto-enrolled into a plan without subsidies. So where does the SEP come in? There is a standard SEP available for any current enrollee who is either determined newly eligible or newly ineligible for premium tax credits. So in this case, people may actually be eligible for two SEPs. The first is when people who are auto-enrolled into a plan without PTC, they are going to get an SEP because they are being newly determined ineligible for tax credits. So they'll have 60 days after that automatic redetermination of ineligibility to select a new plan for 2018. And their eligibility notice from the marketplace should note that they're eligible for an SEP. Now, if the individual returns to the marketplace at any time after losing eligibility for tax credits and resolves whatever issue prevented their eligibility for tax credits, then they're eligible for another SEP because they've been determined newly eligible for PTC. One important thing to point out here is that this SEP only applies to people who remain enrolled in coverage during the year. So if a person drops coverage, never effectuates coverage, or has coverage terminated due to non-payment of premiums and becomes uninsured, then they're not going to be eligible for this SEP, even if they become newly eligible for tax credits. So how does this play out in practice? Let's look at David. He is self-employed, and in 2016, he signed up for health coverage through the marketplace. He made too much to qualify for tax credits and paid the full price for a plan in 2016. In 2017, his income went down, and he reported the change to the marketplace. He was awarded tax credits and remained enrolled in his same plan. During the auto renewal process for 2018, the marketplace looked at his 2016 tax return income, and it showed that his income for that year was over 500% of the poverty line. Because his past tax year income was so high, he cannot be redetermined eligible for PTC, even though he is currently receiving them. So he is auto-enrolled into his same plan without PTC for 2018 because he doesn't return to the marketplace, doesn't realize he needs to. He's auto-enrolled. An SEP is triggered at that time of the new determination of ineligibility for PTC. So let's say that David decides to use this SEP. He returns to the marketplace after open enrollment has closed, and he reviews his auto-enrolled plan. He agrees that his income projection will be over income for PTC eligibility, since he expects to make more money in 2018 than in 2017. So he leaves the income projection as is, and his PTC ineligibility doesn't change. He remains ineligible for tax credits. But the premium for his current plan has gone up significantly, so he decides to use the SEP to switch to a cheaper plan. But let's say that later in the year, David's income goes down again. He returns to the marketplace to report the loss of income, and he is determined newly eligible for tax credits. He's maintained coverage throughout the year, so he is once again eligible for an SEP. And so he'll have 60 days, and he can use the SEP to pick a new plan. We're going to say that he picks a plan on March 18th, and this SEP follows regular coverage effective dates, so his new coverage will begin on May 1st, which is the second following month following plan selection, which is confusing, but we have a bunch of resources for you guys to look at. One that's about halfway down, the special enrollment period reference chart, that has a lot of information about all the different SEPs that are available, when coverage effective dates are, what coverage effective dates means, and has a lot of information. So if you have sort of general questions about SEPs, that's a great resource. We also have we have a lot of resources. So we have a sort of fact sheet on past due premiums. We have the webinar on data matching issues that Shelby mentioned. We also have that reference guide for documents for verifying immigration status. There's a guide for household income DMIs, and then some fact sheets for some of the discontinued 2017 plans to help you guys with that. So with that, I'm going to turn it back over to Hannah, who I think is going to answer or ask a few more questions.
Wonderful. So we've got a lot of really great questions. Unfortunately, we only have time for a few. But first, for the exceptional circumstances SEP, does the natural disaster have to have happened during the open enrollment period?
No, and Shelby, you can jump in here too. It has to have been in 2017 and affected enrollment, but in general, it doesn't have to. The actual disaster does not have to have happened during open enrollment.
Great. And so for people that are moving from California because of the fires and they go to, say, Florida, are they eligible as well for the SEP?
That is a great question.
So what I would say is that there is always a special enrollment period for exceptional circumstances. So while we talked about some specific ones that healthcare.gov has said this is how we're going to handle these disasters that had occurred during this time period, there's always a special enrollment for these exceptional circumstances. And there's other special enrollment periods, including things like moving. So oftentimes, it's a matter of exploring all the different, possibilities. And it might be that they would be able to go ahead and say, this is my circumstance. I was in California. I had this, I was affected by the fire. I moved to Florida. And I, want to be determined eligible based off of that. And by the way, if they're in Florida, because the whole state of Florida is in this circumstance, the open enrollment period effectively is going to be, until the end of the year.
Okay, sounds like there's a lot of options. And so to clarify, if someone had an Anthem PPO in 2017 and for 2018 they only had the Anthem HMO option and they were enrolled in that similar plan, are they still eligible for the SEP?
So this gets a little complicated. They want to look at the notice from their insurer, and it will say your plan is either available next year or your plan is not available. Oftentimes when your plan is still available, they can change your plan quite a lot. So if the cost sharing changes, if the network changes, the plan can look very, very different. But if they're keeping that same, essentially what they refer to as a product of this coverage, then
But just to be clear, that changing from a PPO to an HMO is a significant plan change,
yes.
And I would have a hard time believing that that's a product change.
Yeah.
So that's different, and this would be the kind of plan that you would be able to be eligible for this SEP.
Exactly.
Great.
Exactly.
And back to that past premium issue, can issuers collect on premiums that were missed before the issuer sent the notice?
No. So the notice has to have been sent. It has to be after the effective date that's listed in the notice, so when the policy goes into effect for the issuer, and it has to be after the effective date of the regulation, which was June 19th of 2017.
Okay, and are there any assistance programs to help consumers navigate data matching issues in their native language? Someone's saying that healthcare.gov is sometimes not able to help clients that don't speak either English or Spanish.
Sure. I mean, that can be very complex, and one of the reasons is because the notices that are provided to consumers about data matching issues are generally in English and Spanish only, which then, as you can imagine, it becomes a little bit of a challenge if you know, you speak Arabic and you're looking at a notice that's in English, and then you're trying to say, you know, to the marketplace, you know, hey, I don't know what's happening, you know, in this notice I got. So that could be a big problem. I think the best thing to do is, unfortunately, to look at, you know, find local help now. There's a variety of different options there. The groups that provide application assistance generally are required to also provide language access, and will generally have a plan in place to be able to accommodate the different kind of needs that consumers have, the language access needs.
Okay, thank you. And unfortunately, I think it's probably time to wrap up. So just a few words in closing. So as a reminder, we will be distributing the slide deck and a video recording of today's presentation via email in the next week, and we will post everything to our Beyond the Basics website at healthreformbeyondthebasics.org. So all of the materials from our Beyond the Basics project are posted to this site, including reference charts, guides, frequently asked questions, and key facts. And you can also keep up to date on any upcoming webinars by going to that site. So we don't have any additional webinars scheduled at this time, but we will pick right back up with new webinars on new topics such as appeals in the new year. So if we weren't able to get to your question, or you need any assistance going forward, please email our Beyond the Basics contact email at beyondthebasics@cbpp.org. And with that, we will bring this webinar to a close. So thank you again for joining us today, and have a happy holidays.